Chemical barrier. Cavity lining materials may be required to form a protective barrier against potential chemical irritants present in some filling materials, phosphoric acid in silicate materials, and acrylic monomers, and in some resin-based materials are two such potential irritants. The situation may again be complicated if the cement itself contains irritants. Some cements may be suitable for use in shallow to medium depth cavities, but totally unsuitable in deep cavities where they may be placed adjacent to the pulp. Set against these conventional arguments is a gathering wealth of knowledge which suggests that conventional wisdom relating to the effects of some chemicals, particularly acids, on the pulp has been misguided. It is now accepted by most authorities that the dentine and the pulp are able to survive contact with quite powerful acids, such that 37% phosphoric acid, providing that access to the pulp is effectively sealed at the end of the course of treatment. Hence, creating a chemical barrier is now seen in terms of generating an adhesive bond at the tooth material interface so that leakage at the margins can be reduced or eliminated. Electric barrier. When two dissimilar materials are placed adjacent to or opposing each other, such that amalgam gold, it is possible to set up a galvanic cell which not only accelerates corrosion but can cause pain. The use of an electrically insulating lining material helps to prevent such activity. Unfortunately, most of the lining materials used are either water-based or contain polar organometallic compounds. They are not, therefore, ideal electrical insulators. Varnishes consisting of less polar resins, such as polystyrene, may be used to provide some electrical resistance. These are sometimes painted onto the surface of metallic restorations, giving temporary relief to the symptoms of galvanic pain. Strength and flow. The vast majority of cavity lining materials are supplied as two components which are mixed together, initiating a setting reaction. The setting characteristics should allow the sufficient time for mixing and placing in cavity, followed by rapid setting in order that the filling material can be placed without too much delay. The lining should remain intact during the placement of the filling material. The integrity of the lining depends on several factors. Number 1, the degree of set achieved at the time the filling material is placed. Number 2, the strength of the set material and its thickness. Number 3, the type of cavity. Number 4, the pressure exerted during the placement of the filling material. Number 5, the degree of support from surrounding structures. Number 6, the choice of correct operative technique. When an amalgam restoration is being placed, it is important to ensure that the lining is fully set, or there is every possibility that the material will undergo considerable flow due to the high pressure used. It can be seen that in both cases the insulating layer of lining is lost and amalgam comes into close contact with the dentine.